In 2013, the National Colorectal Cancer Roundtable, which is a group that's supported by the CDC and by the American Cancer Society, but consists now of over 90 members, unanimously adopted the goal of achieving 80% colon cancer screening rates by the end of 2018. It's the 80 by 18 campaign. This has been a wonderful, energizing, motivating campaign. We now have over 400 national organizations from virtually every venue, large employers, a governor, big not-for-profits, government agencies, health plans, hospitals who signed a pledge to commit their resources to achieving this 80 by 18 goal. So that's terrific. What we've also recognized, however, is that it's going to take a lot of work. It's not enough just to sign a pledge. We have plateaued at about 65% colon cancer screening rate. To get to 80% colon cancer screening rates is going to take a really national concerted effort. But I'm very excited about the energy around this public health goal. And I'll tell you the reason why it is the right goal and why people have become so engaged. And it's because the evidence tells us that the impact can be enormous. There was just a published paper in the journal Cancer that shows if we achieve 80% colon cancer screening rates by the end of 2018, we will prevent 277,000 cases of colon cancer and 203,000 deaths from colon cancer by 2030. We'd realize all of that benefit just in a 15-year period from where we are today. So this is a wonderful public health goal. There's a lot of energy about it. About half the states have already convened their own state-based initiatives to see how they can achieve these goals within their state. And states love that public health competition. It gets people really energized. Nobody likes having low screening rates. But the clock is ticking. So we got to really keep pedal to the metal to try to achieve that 80 by 18 goal.
There are definitely some good evidence-based strategies that have been shown to increase colorectal cancer screening in practice. So when you go to the Guide to Community Preventive Services, otherwise known as the Community Guide, they outline pretty clearly some evidence-based strategies. So there are client-directed ones, which would be client reminders. So that's when you get a postcard or a phone call from your provider or even your insurer sometimes saying you're due or overdue for screening, come on in and get your test. And then there's reducing structural barriers. So that would be things that like transportation, cost, even things like clinic hours. So having hours on a weekend, let's say, so you don't have to take time off from work to get that colonoscopy or screening test. And then there's things like small media, which have also been shown to increase colorectal cancer screening rates. So those are small, not mass media. So smaller pieces of media like postcards, handouts, flyers, things you see in your doctor's office that provide little bit of information about colorectal cancer screening and why it's important. Then there are provider-directed interventions, so provider reminders. So obviously providers have a lot of things to do. They're busy. They're not necessarily just thinking about colorectal cancer screening all the time. So having that reminder pop up in your electronic health record or a paper reminder to say, hey, this person's due for colorectal cancer screening. Can you facilitate that process? And then provider assessment and feedback, because speaking as a provider, we're kind of a competitive bunch, and we don't like it when people show us our screening rates and we're doing a lot worse than our peers and friends. So sometimes that helps spur people on to improve their colorectal cancer screening rates. CDC is doing quite a bit to work on the issue of colorectal cancer screening. As I mentioned, we have our colorectal cancer control program, which funds grantees across the nation to implement evidence-based interventions in partnership with healthcare systems to increase colorectal cancer screening rates in practice. We also have our comprehensive cancer control program, which is in every state, in several territories. And they have statewide cancer plans and committees that address colorectal cancer screening kind of across the board. So not just screening, but also prevention and that connection from those who are diagnosed to treatment as well. And then we have a whole plethora of research projects, I should say. We also recently put out a CME for providers that they are welcome to use that talks about the importance of not just screening, but also providing high quality screening. So we have quite a portfolio of work in colorectal cancer screening. Certainly one of our priorities is one, making sure that screening is accessible to everyone, and two, making sure that when they do get it, that it is of high quality. Our second priority, I think, is to use evidence-based interventions to increase colorectal cancer screening. There are lots of things you could do. There are lots of activities that you can get involved in, but we really want to focus on things that have been shown in the literature to work to increase colorectal cancer screening. So we make good use of our public funds to increase colorectal cancer screening.